I'm covering the steps to implement when your back goes out and how to address your back long term. I'm Aaron Robinette, and this is my Trainer's Insight. When your back goes out, the focus needs to be on feeling better and not so much on fixing your back pain at this point. Often the best remedy is rest and icing at the initial stage of your back going out. Doing exercises and even stretching to your back has a risk of exacerbating your back pain. However, there are some areas that I do recommend stretching if you're able to. The first area is your hamstrings. These hamstring muscles will often tighten in an attempt to protect your low back. When these muscles tighten like this, they will pull on your back and cause more discomfort. To stretch the hamstring, I suggest the lying hamstring, using a strap or even a towel or some other device to put around your foot. You'll lay back, keep the leg that you're not stretching down straight. You'll put the strap, towel, or whatever other device you have around your foot. You want to keep this leg straight, so there is a tendency to bend your knee and try and do this, which is not stretching your hamstring. So keep that straight, pull it back, and hold that. And of course, make sure you stretch both sides. The second area is your quads. In most people with chronic back issues that I work with, it's the quads that are the muscles that are tight long term. One stretch for the quads is a quad stretch with a Swiss ball. You'll place one foot on the ball, set that knee down into the mat, take your other leg out in front. Now keep in mind, if you're really tight in the quads, this may be as intense as you can handle. And if that's the case, I'll have you do the other stretch. But ideally what you'll do is you're going to take your hands up on your knee and lean forward, and then get to a point where that's semi-comfortable and press your hip forward. The other version of the quad stretch is a prone quad stretch. So you're going to lay face down, and all you do here is just take your leg up like this and pull it. If this is a challenge, so in other words, if you're getting your leg up and it's really tight, go ahead and use a towel or strap around your leg so that you can actually aid yourself in pulling your leg that way. The third muscle, and the one that goes hand in hand with the quads, are the hip flexors. To stretch your hip flexors, what you'll do is you'll keep one knee on the ground. You want to make sure you have a nice soft mat or towel underneath the knee. Take your other leg out in front. This is called a lunge stretch. So essentially you're in a lunge position. The knee that's on the ground, you want to take that arm up, grab that wrist with the opposite hand, and what you do is slightly press your hips forward, lean your upper body back, and you lean your body away from the knee that's in contact with the ground. The final area I recommend stretching during this initial stage is the chest. The chest tends to be tight in most people, especially those with back issues. When you can stretch tight muscles in the body, this will reduce the tightness in the rest of the body, even when these muscles are not directly pulling on the affected area, which in this case is the back. One stretch for the chest is a stretch with the Swiss ball. I like to do both of these, the doorway stretch and the Swiss ball. This one I'm showing is actually a pec minor. The one in the doorway is a pec major, so you get in two different areas of the chest muscle. And what you'll do is on your knees, put your arm over the ball. You want to make sure your shoulder is in contact with the ball. So lay that in there, other hand down. And simply what you'll do is press your shoulder into the ball. And you want to feel that right in this area right here. If you don't feel that, what I simply want you to do is just slightly change your position of your arm or where the ball is in relation to your shoulder. You want to make sure the ball isn't too far behind you or too far in front of you, or your arm is over like this. You want it a little bit more out to the side, again, pressing your shoulder into the ball. For the doorway chest stretch, what you'll do is you want a doorway or a solid object. You're going to place your forearm against that solid object. You want your arm in an L position with your upper arm parallel to the ground. What you do here is simply just rotate your body. Make sure you keep your head neutral there will be a tendency to turn your head. When that happens, I found that that actually reduces the effectiveness of the stretch. So you keep your head neutral and then just rotate. Once your back feels a little bit more stable and a bit better, it's time to focus on the long-term solution for your back. When your back goes out, it's almost always a case of imbalances within your back that leads to repeated stress to your back and weaknesses that finally give out. It's always best to have a comprehensive assessment to address your specific areas that are tight, weak, and out of balance. For the purpose of this video, I'll discuss the most common areas that need to be addressed. The first focus is stretching the tight areas common with back pain sufferers. These are the quads, hip flexors, and chest, which I showed a little bit earlier in this video. One other area to stretch to see if you are tight is a quadratus lumborum. For the quadratus lumborum stretch, what you're going to do is you want to get next to a wall or solid object, arm's length away. You want to make sure, this is the key here, so that people wanting to get really far away and then lean into the stretch. It's not the way to stretch this. You just want to get far enough away to where your arm is straight, other hand on your hip, and you'll simply lean. So in this case, I'm stretching my right quadratus lumborum, and then when I switch arms, it'll be my left quadratus lumborum. You want to find out if those are tight and stretch the tight side or both sides if they're both tight. Then you need to strengthen the weak areas. The most common in back pain sufferers is the lower abdominals. These should get you in a good spot to reduce your chances of future back pain issues. The exercise to work the lower abdominals, what you'll do in this case is lay face up, knees bent. You're going to take one hand, place it underneath your low back, roughly right about your belly button level. Another point of reference to that, if you're having a problem trying to find your belly button according to where your hand is the highest point of your curve of your low back. That's where you want your hand to place your hand at. What you'll do at your starting position before you do any movement is you want to take your back, press it against your hand, just nice steady pressure. So you don't want to crush your hand, but you just want to have nice, even, steady pressure. So the exercise in this case is you're going to have one leg staying down and you're going to raise the other leg up and back down. As you set it down, set your heel to the ground and back up. Don't let any pressure off your leg. So in other words, you don't want your leg coming all the way down. You just want to touch it and bring it back up. So you want to perform between 8 to 12 reps on one leg and then repeat on the opposite leg. So right like that. One key here is if you find that way before you get to that 8 reps, you start having problems holding your back against your hand, stop the exercise at that point. Whichever side is the weakest, that's your limiting point. So what I mean by that is if you can only do 4 reps this way on the left leg before your back starts lifting up, but you can do more reps on your right leg, only do 4 on both sides because you want to keep those sides even. And you want to do that until your left leg becomes stronger, or whichever side becomes stronger. The next progression for this exercise is everything's the same position. So hand underneath your low back, pressure in your hand with your back. You're going to raise one leg up, hold that in that position, and now you're going to work the other leg. So up and down, sitting the heel down. Everything's the same in that case. So all the reps on one side, and then when you're done, switch all the reps on the other side. And then the final progression I'm showing on this, and there are a few mini progressions in between, but for the purpose of this video, the final one I'm showing is both legs at the same time. Everything's the same starting. So pressure on your hand with your low back, and then you're going to bring both legs up at the same time. Set both heels down, just touch, and back up. Right like that. One other key I want to address, I have a lot of people asking me about this. Which hand, or should I switch hands as I do the exercise? That's a personal preference. If you like one hand over the other, or if you like switching hands, Use one hand on one side, use the other hand on the other side, that's fine. But only use one hand, don't put both hands under, because that gives you too much of a lift, and that's reducing the stress of the exercise, which is not what we want in this particular case. Let me know in the comments below how well this information works for you. Also, let me know if there's any tips or information you want me to cover in one of these videos. And for more tips, information, or if you want to find out more about personal training, go to my website, aaronrobinette.com.